So the bacteria will walk down that little stitch and it'll go into that little area, and sometimes patients will have some pus. They see redness and they see pus and they see a stitch, and it's kind of like, oh my God, what's happening? But it's really not a very big deal. It's pretty minor. Okay, so we're 1 month out with a patient here. She had lipo and she had a tummy tuck. I just want to show something because this happens not just with tummy tucks, but this happens with any surgery really, where we use stitches that absorb and the body will dissolve them with water. And she had, just lower your, just a tiny bit. Okay, so you can see here, this is her incision, but you can see, okay, this all looks fine, everything's good, everything good. Oh, what's there? Oh, what's there? What's there? And so she had a little redness here, and she was saying that the stitch came out and she was really worried about it. So if we actually go in that little spot, that looks like just a little hair there. I don't think that's a stitch. But in this little area where you see a little bit of redness, and you can see two little lighter areas where the stitches were. So what we call this is spitting a stitch. And so sometimes what happens is, ideally what will happen is that stitch is tied underneath the skin. It's an absorbable stitch. So that stitch will then dissolve and your body will dissolve it. But sometimes if you get one of those little stitches, it can kind of break through the skin, and then once it becomes exposed to the air, it won't dissolve because it requires water to dissolve it. And then what you have is you've got an access for the little bacteria, and it's a braided stitch, so it's almost like a little ladder that we've built for them. And then the bacteria will walk down from the skin, because remember, our whole skin is all covered with bacteria. That's normal. So the bacteria will walk down that little stitch and it'll go into that little area, and sometimes patients will have some pus that will drain there. It's not a whole infection of the area. It's what we call a stitch abscess. So it's a little local area, and to treat it is you just remove the stitch, or sometimes the stitch just falls out, and then that just heals on its own. But it really makes patients pretty nervous when they see it, because they see redness and they see pus and they see a stitch, and it's kind of like, oh my God, what's happening? But it's really not a very big deal. It's pretty minor, and it's very easy to treat just by plucking the stitch out. Don't need any antibiotics, soap and water. And once you remove the stitch, it's left a little open. It's a very small hole, and that's what you want to have, because that will, your body will fill it in from the bottom, and it'll push away all the bacteria and the pus, and it'll just close over like hers has done. Now hers is still a little bit of red, and you can see some of this grayish, but that'll all heal properly, and her scar will be just like it is here. And she's doing pretty well. Her scar is looking pretty good. Her scar around her belly button is looking pretty good, and she's a month out. So at this point is when we start. I like patients start scar care at about this time, or 3 weeks, and they will massage with a scar gel, and then they wear a silicone strip at night. But I don't like patients to do any of that. If we have a little area where a stitch is being spat, then it's safe to do other areas, but I just don't want anything getting in that area except soap, water, and gauze.